Good morning, all of you. Myself, Shahanawaz Khan, Rama, lecturer of Rama College of Nursing. Today we will discuss about asthma. So, asthma is a chronic inflammatory disease of airway caused by bronchoconstrictions as well as spasm. So, there are some etiological factors for asthma and causes. So, first of all, there are some etiological factor, environmental factors. Environmental factor also responsible for asthma. Change in temperature, for example, like cold air, and change in humidity like dry air. So next one is atmospheric pollutant. In atmospheric pollutant like cigarette smoking and industrial smoke also, and sulfur dioxide and formaldehyde gases is responsible for asthma. So next one is allergen inhalation. Allergen inhalation, for example, like food with sulfate. We have taken the food with sulfate, and beer, like beer and wine, that is also responsible for the asthma condition. And the next is stress and emotional stress and emotional upset also responsible for the asthma condition. So next is medication. For medication, NSAIDs, non-inflammatory, NSAID, non-anti-inflammatory drugs is also responsible. For example, like ibuprofen, diclofenac, nimesulide also responsible for the asthma if we are taking regularly this NSAID drugs. And beta blockers drugs like propranolol and atenolol drugs. So now we are some risk factor. There is physical examination and physical history and history collection of the patient. History collection and passive smoking means like excessive smoking. And the next one is obesity. Obesity means patient having a obesity means high grade weight, and low birth weight means at the time of the birth we have low birth weight. And next is regular of the NSAID drugs, NSAIDs drugs like diclofenac and ibuprofen, aceclofenac, nimesulide, etc. So now clinical manifestation and silent symptoms. What are the silent symptoms for the asthma condition? So chest tightness will happen, tightness, and cough, regular cough, and early morning or all night, full night cough may be happen, or early morning coughing is. So chest tightness and dyspnea means shortness of the breathing or difficulty of the breathing, and prolonged expiration, and hypoxemia. Rochi means difficulty of breathing when we are taking the deep breath. And the attack of the asthma may be for few minutes and few hours. So now what are the complications for asthma condition? In asthma condition, what are the complications? So there are some complications may be happen like respiratory failure, cardiac arrest also, and pneumonia also, and atelectasis condition may be happen. So now diagnostic evaluation. What are the diagnostic evaluation we can do? So in diagnostic evaluation, first of all, history collection, physical examination, and spirometry. Spirometry is a test for the lungs or pulmonary functions, for check the pulmonary functions. And ABG, artery blood gases, we will check, and chest X-ray, CT scan, auscultation by the stethoscope, and deep breath we will say to patient. take the deep breath and check the any sound is coming or not. This is auscultation. Then management. In management, medical management for asthma is there, but not surgical management. Medical management, bronchodilators medication. First of all, bronchodilators means in this bronchodilators, salbutamol and albuterol, formoterol, these drugs is the bronchodilators for the relaxation of the muscles for especially bronchi. And the next one is diuretics medication. Diuretics also we will provide to the patient for asthma patient, like theophylline, darbepoetin and aminophylline. So next one, anti-allergic drugs. Anti-allergic drugs, so ibuprofen we will use to the patient, and atropine sulfate we will provide to the patient for the relax the muscles of pulmonary muscles. And the next one is corticosteroid also we will provide. This is very important drugs for the patient of asthma. Betamethasone and bisolone and prednisolone, these some medications, betamethasone, bisolone and prednisolone, these drugs are also very important for the asthma condition. If patient are coming in the hospital in emergency, we will use these drugs. So next in antagonist drugs, so antagonist drugs like montelukast and zafrolukast, these two medication for antagonist condition. So next is mast cell stabilizers. Mast cell stabilizers control the mast cells for the asthma patient, like cromolyn, sodium. This is the function of the mast cells. So next is asthma. So key of asthma: A for adrenergic, S for steroid, T for theophylline, H for hydration, IV we will provide, and M for mask with oxygen for the patient, and A for anticholinergic. So this is the key of asthma. So now we will discuss about what will happen asthma condition. So pathophysiology. So pathophysiology due to etiological factor, some causes or some etiological factor, due to etiological factors. Now chemical mediators will release. After due to etiological factor, chemical mediator release, then parasympathetic nervous system affected, and then bronchoconstriction condition will happen, and after that sympathetic nervous system affected, now dyspnea condition will happen. So now nursing management. What are the nursing management? Nursing management, we will check the assess the patient head to toe, physical examination, history collection. We will check the patient vital sign, and hourly we will check patient respiration, and patient we will check the airway of the patient, and we will provide the medication for the patient, and provide the health education, avoid the smoke, and check the patient's history, any allergic allergic history in the family, and provide the good nutrition for the patient in the hospital, and provide the psychological support. So that's all. Thank you.